Endometriosis is definitely a disease, let's say, that can impact one's chances of getting pregnant, so it can impact fertility. About 15% of patients have endometriosis. The classic way to diagnose endometriosis is to have surgery called a laparoscopy, where the surgeon will look in the pelvis and look for classic lesions or areas and biopsy those and then confirm a diagnosis of endometriosis. We used to do a lot more laparoscopies in what I'm going to call the old days, 20 to 30 years ago. We don't do as many laparoscopies anymore because we've learned over time that even if we do surgery and try to remove your endometriosis, it does not really improve your chance of getting pregnant. So most patients with endometriosis need to actually undergo IVF because the process of having the endometriosis in the pelvis yields an inflammatory process where scar tissue can form in your pelvis. Now your tubes are either blocked or not working functionally. The egg is not able to find its way into your tubes. Egg and sperm don't find each other. End up having to do all of that for the patient in the petri dish in the laboratory, which of course requires doing IVF. It is not uncommon that patients with endometriosis do need to do IVF. There are typically two kinds of symptoms that patients with endometriosis can have. So one is the infertility piece, and then the other one is a pelvic pain component because that inflammation in the pelvis can also yield pelvic pain. But not everybody with endometriosis has the pelvic pain piece. And just like not everybody with pelvic pain necessarily has the infertility piece. Even though you may not have pelvic pain, you could still be somebody who has the infertility component of endometriosis. So when you work with your fertility physician through your evaluation, we may or may not discuss endometriosis as potentially being a part of the process that may be leading to your infertility.